Cerebral palsy. So what is cerebral palsy? Well, the word cerebral means having to do with the brain, and palsy means weakness or muscle problems. CP is a group of disorders, and it has the abnormal brain affects ability to control muscles. And if you have CP, you may also have seizures, vision, hearing problems, scoliosis, and joint problems. There are four main types of CP. The first one is spastic CP, the second one is dyskinetic, the third one is ataxic, and the fourth one is mixed. First, we're going to talk about spastic. Spastic is the most common and affects 80% of people with CP. And there's also different types. Spastic diplegia / diparesis means that you have muscle stiffness in the legs and your arms may either be only mildly affected or not affected at all. So you may have problems walking, sitting. And then spastic hemiplegia / hemiparesis, it only affects one side of the body and it usually affects mostly the arms. And then spastic quadriplegia / quadriparesis affects all of the body and it's the most severe type. And people that have this usually can't walk and have other disabilities such as intellectual disability, seizures, vision problems, hearing problems, or speech problems. And then the second type is dyskinetic CP. And if you have dyskinetic CP, it may be hard for you to control the movement of hands, arms, feet, and legs. And movements can vary, so they can either be really slow or they can be the opposite. They can be really jerky, fast, sudden movements. And also it can sometimes affect the face and or mouth, which makes it hard to swallow and talk. And as I said earlier, the muscle tone can vary from too tight to too loose, and it can change not only day to day, but also within one day. Some movements may be slow, and then some may be jerky. Ataxic and mixed CPs. So ataxic CP affects balance and coordination, and it's hard to control. It's hard to do quick and controlled movements such as like writing or reaching out to grab something. And then mixed CP has symptoms of several types of CPs, and the most common type is spastic dyskinetic CP. Some causes. Congenital CP means that it happens before or during birth. Sorry, there's a typo there. It's supposed to say during birth. And it's the most common, so 85 to 95% of CPs are congenital. And so there are many different causes of this type of CP, and usually the specific cause is unknown. And so there are some risk factors that can play a role, and just as a disclaimer, these do not mean that a baby will have CP. These are just risk factors. So being underweight, premature, having twins or triplets or even quadruplets, and if the pregnancy was induced by infertility treatment, infections during pregnancy, blood type differences of the mother and child or of the mother and father, medical conditions that the mother may have, and birth complications. And then acquired CP is within 28 days after birth, and it's usually caused by an infection or head injury. So treatments. So there is currently no cure, but treatments can help improve the quality of life. And so some treatments include surgery, braces that are seen in this picture on the right, but there's also different types. And then also therapies such as physical, occupational, and speech therapies.